Okay, so we're going to go over some abdominal X-rays at the moment. So this is a dog with a suspect foreign body. So these are our survey films. So you always want to take a survey film, VD and lateral. But this is fairly normal with the full stomach. So you can see the stomach right here is full, but it is in the normal position. So it is sitting, usually you see them parallel to the rib cage, so your stomach's going to sit there. Your liver sits right here. You want to see this nice little rounded area of the liver, little jet comes out. Sometimes it comes out past the rib cage. And then you'll notice that the bowel is very just gassy, but all over, so it's not bunched up in one area or the other. Here's your spleen. Your spleen is going to be a little triangle right past the liver, mid-abdomen or cranial abdomen. So that's kind of like in general, your bladder is going to be back here. You want to notice nice borders of the bladder. But generally you want to just make sure everything's sitting in the nice soft spot. So here we have the VD, and you want them to be as straight as possible. So you'll notice the spinous processes on the vertebrae are pretty much right on top of each other, which is what you want. You don't want it shifted to one side or the other. You notice your stomach is full of food, so your stomach's going to sit up here. And this is the left abdomen, so you want to always remember when you're viewing an X-ray, you want to shake hands with it. So you want your left to shake hands with their left. So this is going to be the left. And then you're going to shake your right hand is going to be on your right. So just that's how you always view an X-ray. The diaphragm has 3 humps to it. So that's what we're seeing here. We're seeing one hump, the other hump, and then the other third hump is in the back. That's all normal. And you notice that the bowel is very dispersed throughout the abdomen. You can see some pretty good detail. You can see gassy patterns. You can see the bowel. You can kind of see a good X-ray. And your spleen is, again, the little triangle part of the spleen is right over here. So everything's sitting about where it should. So this is a dog that we suspected may have an abdominal mass, and I just kind of wanted to go over a couple things. So here you can see the stomach is empty, but see at the angle that it's sitting at. So it's sitting more across the dorsal area of the abdomen instead of kind of parallel with these ribs. So I already know my stomach is being displaced dorsally. And then also look at the liver. So like I said, the liver is supposed to have that nice little sharp piece. This is a very rounded, thickened liver. And there's a likely mass like all in this area. It's actually probably at the bottom of the stomach all the way down here, from here to here. And when I measured it, it came up like 13 centimeters to 10 centimeters. So there's the spleen. So the spleen is this little triangle piece right here. Probably not involved at all. And you notice our bowel is kind of all bunched up to the back. So here's the VD view. You kind of notice that the stomach is, a little bit smaller, pushed here. But the one thing that stands out to me is all the bowel is kind of over in this area. It's kind of been all over pushed. The spleen is a little enlarged, so it's right here. So I'm not sure if that's involved at all. But this review isn't as remarkably obvious as the other view. So this is a dog that actually had some ascites, so some fluid in the abdomen. And as you can see, the stomach is empty. It is sitting in the normal position. But one thing that you notice is a complete loss of serosal detail. So you can't see edges of the bowel. You can't see gas patterns. You can't see where the liver edges is. You can't see a whole lot. So that's called a ground glass appearance. And that is very specific to fluid, whether it be blood or serosal fluid or chyle or infection. You don't know. You just know that there's fluid in the abdomen. And here's that dog on the VD appearance. You see the stomach. This is just the rugae and the stomach and all. That's pretty normal with the gas pattern. But you also just notice how rotund the belly is. And the fact that there is that loss of serosal detail.